Hi, my name is Michael Herrera. I'm a physical therapist here at Evolution Physical Therapy and Fitness here in Beverly Hills.
Hi, my name is Lukas, 26 years old, and I work as a caterer. Very active person, like to hike, like to run. Been a long time patient here of Evolution Physical Therapy and Fitness with their new location here in Beverly Hills. Looking forward to running the LA Marathon early next year and amped up some of my running, first time marathon runner, and experiencing quite a few pains in the calf and the foot. So I decided to come get it checked out, get taken care of by these guys, and get back to doing what I love.
Hi, I'm Michael. I'm your physical therapist today at Evolution Physical Therapy. How's it going today? Tell me about your pain.
Yeah, I've got some pain here in the heel, kind of at the base of the bone right there. Happens a lot in the morning when I wake up.
Okay.
Walking a little bit seems to go away. Yeah, that's kind of where it's at right now.
Okay. Go ahead and take that shoe off for me.
Okay.
So where do you feel the pain?
Right here, kind of at the end of this bone.
Okay. And then does any of that pain come up into the toes?
Yeah, it goes up here on the arch.
Okay, and then hop up back into the heel.
No,
Not too much?
No.
Okay. So what we have going on with Lukas here is classic plantar fasciitis symptoms. He deals with this ankle instability. He is unable to use the foot intrinsic musculature to help support this plantar fascia. So whenever I go over an injury for any runner, any patient, we always ask this victim culprit kind of questioning. Is something causing the issue or is something the issue? And with him, his foot intrinsics are just so weak, his ankle stability is gone, his plantar fascia is just unable to support his new training regimen and the increase in mileage. So let's go ahead and hit the ground and go to the grass. It's not real grass.
Are you sure?
Let's go ahead and start with the foam roll. And go ahead and sit on your hips and then put this underneath our calf. So even though we have a plantar fasciitis pain, I want to focus on the calf tissue here too, because I noticed that was tight, and what that does is it puts increased strain down here into the Achilles, down into the heel, which in turn comes down to the plantar fascia. So go ahead and roll back and forth on this foam roll here. So you'll notice as you go through this, there's more tender spots. Go ahead and spend a little extra time and really dig into that. If you want to increase the intensity, we can go ahead and lift this foot onto the other, and then your body weight will increase therefore, making that feel a little more comfortable. So what we're doing here is because the plantar fascia is connected into the heel where the Achilles tendon, and then we get the gastrosoleus involvement. We want to target the tissue from all angles, right? So we target the main tissue as well as we kind of free up any adhesions he might have up into the calf. So next one is focusing on the strength of the foot. So one of the main stabilizers of the foot is what's called this posterior tib tendon. So it kind of runs through, grabs underneath. You're going to wrap this around the foot here. I'm going to stabilize here, and what I want is you to swing your foot and point it toward this direction. So down and in. Good. So one thing I'm looking for here is not only that he's contracting the foot, but on the way back, he's slowly controlling it back. If you do this at home, it might be a little jaggedy, and we want to really slow and control that foot. Now, a way we can get Lukas to do this at home on its own is he can kind of bring this foot over this way, use that as a fulcrum point, and then now he controls the entire exercise. Then next, we want to work in the other direction. So he's going to bring this foot on over. Okay. He's going to pull that band out, and opposite idea, he's pulling the foot up and away from the body, so kind of coming toward me now. Really make sure this stays nice and stable. You want to kind of come through that range, 2 sets of 15, same idea as before, slow on the way back, don't let the band do all the work. So our next exercise is what's called toe yoga. So step 1 here is I want you to focus on lifting this big toe up off the ground. Good. And then now we're going to put the toe down and lift the other 4 up off the ground. So So what I want you to do is kind of go back and forth of this motion. What this does is help activate and kind of strengthen the little small foot muscles underneath that foot, kind of adding additional support to that plantar fascia. If you're having a hard time doing this at home, it's because these muscles aren't used to being worked. Our next exercise I want to send them home with is basically what's called an arch lift. Lucas, I want you to focus on lifting the arch through the middle and adding little support. So if you notice, he's kind of gripping the floor a little bit. So that's one of the common mistakes I see all the time. So now he's lifting the arch up. So go ahead and hold that. So this is what your foot should be like when you're normal standing, is you have this good arch lift here, that good activation underneath the pattern. But if you notice, go ahead and just relax completely. How much his foot kind of slams down. So if those muscles aren't working when you're running prolonged distance, miles 6, 7, 8, 9, all that foot just kind of slams down, and like Lucas, we often see this kind of increased pain at the bottom of the foot.
All right, so I just wrapped up my first visit here with Mike. Super helpful. He was very, very inquisitive, asked a lot of questions. I felt like he genuinely cared. I'm super stoked to go home, get working on some of the stuff that we worked on, the foam roll, the band stuff with my ankle two-way, that toe yoga, and the arch lift. I felt like those were the right idea for where I'm at with my pain, and hopefully this gets me back on track with my training. Some of this pain goes away and I can get back to doing what I love, being the marathon.